Well, welcome to York County on Community 7 Television. We are watching a very special York County on Community 7 Television. Right now, as we record, we're still in the social distancing aspect of the COVID-19 pandemic. So we're happy to bring you the York County program via teleconference. We're very excited to have Casey Williams with us. Casey is with Yellowstone County Disaster and Emergency Services, and obviously this has been a very busy time for him over the last couple of months, and I'm sure it's going to be a very busy time for him coming forward for the next couple of months as well. So Casey, thank you so much for taking the time out to come visit with us about this and talk to us about the county's reaction to the COVID-19 pandemic.
Thank you, Shoots. It's a pleasure to be here.
All right. Well, let's get started. Let's go back, take a step back a little bit, I guess, and tell us a little bit about, what is your department? What is it here to do? But, before all this pandemic stuff, what is it that Yellowstone County Disaster and Emergency Services is designed to do?
Well, I've been in the position now 16 months. I've been in Montana for 16 months. Glad to be here.
Yeah.
The Disaster and Emergency Services Department for Yellowstone County is responsible for the mitigation, planning, response coordination, and recovery from man-made natural disasters, as it turns out, global pandemics as well, and the such. So we do all of the planning, coordination of mitigation efforts, grants management, response coordination and support, and then supportive of recovery efforts if anything happens in Yellowstone County, including the cities.
Sure. So I guess prior to our current situation, the pandemic, how did your department work with Riverstone Health, Unified Health Command,
Right.
and other such entities within Yellowstone County? What did you guys do together before the pandemic started?
Well, DES is part and has been part in Yellowstone County of the Unified Health Command, which is Billings Clinic, St. Vincent, Riverstone Health, and Yellowstone County DES. So prior to this, our working relationships, we have the Health Management Group meetings. We have our LEPC, Local Emergency Planning Commission. We're all part of that. We do exercises and training surrounding different healthcare issues. An example of that is we had a tabletop exercise not too long ago concerning measles and how we would deal with that. And so we do a lot of meetings. We do a lot of conversation where we work very well together with the Unified Health Command, DES. A lot of planning goes into how would we respond to a particular health crisis or a breakdown in our healthcare system. So that relationship has been there for quite some time. This has obviously, I think, strengthened the relationship and brought some opportunities for improvement and some really glowing things that we do real well.
Yeah. So walk us through maybe what one of those planning exercises looks like, prior to being in the middle of a pandemic. Is that something that your department's in charge of? Is somebody else in charge of doing that and you're just there as a team member? Walk us through that, maybe that measles planning session. What did that kind of look like, and who are the actual players sitting in the room while you're doing that exercise?
Okay, so like, for instance, the measles exercise, we had the hospitals, Riverstone Health, some of the epidemiologists and infection control physicians, and we were practicing an outbreak of measles. How would that look in the hospital? What type of supportive measures would we need to do? How would we isolate and quarantine people and mitigate the spread of measles if we had that happen in our community? So we gathered and we ran through the scenario. I was a player in that tabletop that was put on by the healthcare and the HMAG through the LEPC. And we sit at the tabletop, discuss, and go through a little bit of the functional exercise of how would we track this? How would we come to know that there was a measles patient? What would we do? What are the steps in place? And we do that. The last one was for measles, but that type of planning and training goes on a very regular basis because healthcare issues are part of our society, and we have
Sure.
so that it's always a group effort. And what we try to do is train, talk our way through, identify areas that we're not real good at, and then come up with action plans to make that a little bit better.
Okay. And then talk about what, as far as this particular pandemic, when did you guys kind of start the process of planning, and what did that planning look like? And then how does that continue to evolve over the time, doing the planning during the middle of all of this?
So I guess we're planning for certain type of healthcare issues. I don't think global pandemic was really on the forefront of our thought.
Sure.
But we do talk about things that may overwhelm our healthcare system, and how do we do it. For COVID-19, and I'm going to look at my note to get the date right, the World Health Organization issued the health emergency on January the 30th. And then I know the week following that, the Unified Health Command stood up and started meeting on February the 6th. That Unified Health Command being the two hospitals, Riverstone Health and DES, and the supporting staff that comes from all of those groups. So Riverstone, being our health department, they received different fundings and grants for emergency preparedness surrounding outbreak health issues. And so we had the planning state is there. We're familiar with the fact that we may have overwhelming healthcare issues. And then so you draw on those plans, and then you just have to build it out for whatever the issue is at hand. In this case, it was COVID-19, global pandemic. Dealing with the healthcare, that evolved from just not only a healthcare issue, but it grew. And as we had the shutdown, then we had to deal with that. And then obviously we plan for and think about what would happen to our community if we had an incident within our community. But this was a little bit more challenging because this didn't happen to our community. This happened to everybody.
Sure.
But we started planning on what we would do with this, and back in February.
All right. And then, you talked about the aspect of it. Okay, yeah, there's the health aspect of it, but then there was kind of the social distancing aspect of it, and how that would, I don't know, I don't think enforced is the right issue that I want to use. But so how does that kind of filter out into Yellowstone County as far as, are there sheriff's deputies checking on this stuff? Are you guys checking on this stuff? Like, how does that aspect of it work, as far as what the impact is to Yellowstone County?
The social distancing aspect of it, if you want to talk about that. Well, obviously we all have the order from the governor and from the health department that we need to do the social distancing. And there's a difference. So the social distancing is a really good thing to do. And those type of activities, we would ask the public, and it's just common sense. So that would happen with regular flu. If you had the measles, we would say, okay, we need to separate people so that we contain. The shutdown offered a little bit of a different flavor to the. Everybody was really anticipating that early on, but as this grew, obviously we realized that the social distancing, and being a novel coronavirus, being a new virus with no innate immunity among our citizenry and no cure and no vaccine, we kind of had to go old school with this, and we had to separate people, and we had to really push. We got to stay apart. We need to wash our hands, do all of that kind of stuff, but stay apart in order to mitigate the spread of the disease. As far as the checking on it and enforcement, that comes down more to the isolation and quarantine side of things. So when the health department issues a quarantine recommendation or an isolation recommendation, um, the county attorneys here did tell people they would enforce some of the gathering, social distancing. The way that it's been handled so far is if there's an inappropriate or unsafe would be better, not inappropriate, but an unsafe gathering. Um, it's primarily just been asking people to please disperse and separate and be a little bit safe. And to be honest, I haven't seen, me personally, and being in it, I haven't heard of or seen very many inappropriate or congregate getting. Most people are taking it serious. Most people are following the rules. And every time we've asked, or every time I know that we've asked somebody to socially distance or follow the rules, it hasn't been a problem.
All right. How often are you meeting as far as the Unified Health Command? How often does that meeting take place? Is it once a day, twice a day, once a week? How often does that meeting take place?
So we started off with the Unified Health Command because this was primarily a healthcare issue, and we were once a week. Then the incident group, and we started the Unified Incident Command because we had to look at economics, we had to look at the healthcare issue, we had to look at how this whole system is affecting our community. We started out meeting once a day for the command and general staff, and then later that day for the planning meeting. So we were actually meeting twice a day for a couple of weeks. We have since backed that down. So the overall incident command, which includes the economic recovery piece, first responders, Unified Health Command, they're meeting once a week. So that's our, what we call an operational period.
Sure.
The command is also meeting via this 3 times a week. So we still have a primary healthcare issue that we have to deal with. The other pieces of it, we've got some things in place and some balls rolling to help with that. So we can slow those down a little bit. But I'm talking about COVID-19 every day, depending on what group you are. Mr. Felton in the health department is talking about COVID-19 with some group every day, even though staggered.
Sure. So kind of maybe walk us through then, what else does your typical week look like? What else is going on outside of these planning type meetings? What other activities are you undertaking or your department's undertaking during this time?
So life didn't stop, right? So we still have all of the regular duties and responsibilities that we have for planning, for grants management, incident response. So we still track, respond to hazardous material spills. We still report all of our reports to the state. We still are managing the grants that we have out there. The aircraft crash where unfortunately one of our citizens lost his life, that still happens. We still have, unfortunately, structure fires, and we still have the opportunity to have other types of disasters and emergencies that we have to respond to. So on a typical week, you do the regular full-time job that you would do, and the hospital still has to take care of patients. Riverstone's health still has to take care of all of the other health needs of our community. So all of that continues. And then you just throw in what feels like several hundred hours a day on COVID. But a typical day is I come in from my department. I check all of my daily reports to deal with weather, fire weather, hazards that are on the horizon. I read my FEMA daily update to see what's going on there. And then we kick into high gear and take care of the things that we need to take care of today.
All right. Has your planning for stuff like, spring wildfires or summer wildfires, has that had to take a turn? I know you don't know where we're going to be this summer when it becomes fire season, but are you guys planning for that to say, how do we do social distancing fighting a wildfire, or can we, or what kind of steps can we take? Are you guys doing that kind of planning now as well?
Yes, sir. Working closely with the DNRC and the state and other federal agencies that help us in the wildfire season. That is a very big topic of conversation. How can we manage fire camps and get enough firefighters to the scene of a breakaway fire, keeping everybody socially distanced as much as we can, making sure that we don't have sick firefighters in a fire camp. And there's plans in place for monitoring and triaging and checking on their status and making sure people stay well, stay separated. And it has created a logistical challenge to come up with that. But those you can't stop because fire season is rapidly approaching, even possible red flag warnings up in the northern part of the state. So we have to be prepared and do that and live with that new, what you called it earlier, the new abnormal,
Right.
even when we deal with emergencies and things of that nature.
Yeah. What have you learned about Yellowstone County during the course of this COVID-19 pandemic that you didn't even know before? Something that happened that maybe you're like, well, I didn't even know that was out there.
Wow. That's a really good question. There's so many wonderful things that I've found. I'm going to brag a little bit on our community and the way they come together and the ingenuity, especially today, since I was working with some people to get some PPE. I think it's amazing that the Montana mask, the famous Montana mask, has come from physicians, Dr. Richardson and the other physician here. That's gone global. And they haven't been charging for the technology to go out there. The sharing of information, the sharing of technology, the ability to get different innovative ways to meet the needs of our PPE, that is a big surprise. That's a wonderful shining light in our community that I'm very proud that we have here. And then I also think that what I've learned is the community as a whole has really done very well, as evident by we call it the flattening of the curve, and the lower number of cases that we have is because of how well we as a community have responded to the shutdowns and stuff. Of course, everything comes with challenges, so we've also learned some areas that we probably need to improve. Because every time you do anything like this, it's a learning opportunity. So we are identifying areas that we have challenges that we weren't aware of, that were a little bit surprising, but those things we'll work through when this is all over with.
Sure.
I think there's been a lot more positive that have come out of it than challenges.
Sure. All right. Can you give us some details on Yellowstone County? And then again, we're recording this on Tuesday, April 28th. So these numbers will probably change by the time people see it. But give us the best estimates that you have for today. How many people in Yellowstone County have been tested? How many have been hospitalized? How many deaths we've had? And how many recoveries we've had in Yellowstone County?
So as of this morning, so this was earlier this morning, Tuesday, April the 28th, we'll be specific on that. 80 Yellowstone County residents have been tested positive for COVID-19. 62 of them have been reported as recovered from the virus. 19 of our residents have been hospitalized. 3, I believe, are currently hospitalized. And unfortunately, we've had at least one death to the virus. Again, that may be different at 5 o'clock this afternoon.
Right. Absolutely. So, yep. And that stuff's going to change daily and hourly, I imagine. So have you been able to kind of network with some other disaster and emergency services personnel across the state of Montana or across the country to kind of say, well, here's what we're doing, and what are you doing, and have you been able to kind of make some of those connections, and what have you learned, and what have you been able to pass on to other people throughout the country?
So yes, we interact quite frequently, of course, with the state DES. So learned a lot of information from the state about how FEMA and the state are going to respond and help our communities with this unprecedented type disaster. Our fellow Bighorn County, Muscle County, Stillwater County, Carbon County, I've spoken with all of those DES coordinators. We've bounced ideas off. How are you doing? What are you doing? We've tried to coordinate and synchronize some of our closures, the timing of some of the stuff. Now, granted, the governor's orders are statewide, but even locally, we do talk about how are you doing it over there? What's it looking like? Yellowstone County is a little bit different than some of our surrounding counties because we're the medical hub for such an enormous area. So sometimes we have to do things just a little bit different because of the volume of people.
Sure. And right.
No, we talk about this on a regular basis, even as far down as, hey, what do you think the best way to say this to the public is? What do you think the best, how are you going to document this? I had a question just before we started. Do you think this type of PPE will be an eligible cost under the FEMA guidelines? So yes, sir, we talk quite a bit. Gallatin County has been also one of the partners. We've gotten some PPE and worked with them on ordering some stuff. So it's been a real good.
Talk to us about some of the facilities that are probably most vulnerable, I guess, in Yellowstone County. Maybe right. Some of the senior facilities or the jail facility. How have you been working with that senior population, assisted living population, and then also have you been working with the jail facility and interacting with them, and what are some of the things that they're doing as well?
So, I guess early on, mid-March, a lot of our long-term care facilities followed the direction of the health department. The DES department has directly interfaced with our long-term care nursing home facilities, long-term care facilities. That's primarily been the Unified Health Command, working with those facilities. I'm part of the Unified Health Command, but that's more health department, Riverstone Health driven. But they have put in place restrictions to visitation. They've put in social separation within their facilities. They've put in place using PPE and the rules, and then they followed the health department and DPHHS rules on how they would operate there. The jail as well. Earlier, I don't know the exact date, but I think as everybody knows, they let some of the incarcerated people out of the jail so that they could decompress the jail to get a little more space. They have restricted visitation to the jail, just like they have at the hospitals and the nursing homes. They're wearing the PPE. They're doing the social separation. So we've been working with them. The long-term care facilities are under the UHC. The detention facility is part of under the overall incident command structure with first responders. So a lot of communication, a lot of coordination. All of the facilities have struggled to get the appropriate and volume of PPE, but we've also been working very hard to get some of the PPE that's necessary for all of them.
Sure. And then what kind of, I guess, restrictions have been put in place for Yellowstone County and their employees? And, are people designated that have to come into work? Is there telework going on? Talk to us a little bit about Yellowstone, its county in itself, and what measures were put in place as a result of this.
So we're trying to follow our best as far as no more than 10 people in a room. We've separated out all of our meeting rooms with tape. We actually went in and measured to make sure that we had the appropriate distance between chairs. We've implemented, and I'm sure a lot of our public has noticed, the commissioners' meetings are done by Zoom or tele-meetings like this, just like city council meetings have been virtual meetings are in place. The people who are able to telework have been able to telework. Of course, the regular restriction, if you're sick, don't come to work. If you have symptoms, stay away. Masks are available to all of the county employees that want them. They haven't required everybody wear a mask, but they are available to everyone. Some departments that have more difficult time because of the configuration of their office separating have taken advantage of masks and other social separation. But I think our human resources and the commissioners have done a real good job of trying to protect all of our employees.
All right. Let's go. Let's go a little bit on the a little on a down note, but then we'll end on a high note. I promise.
Okay.
What are some of the most difficult moments that you've had over the last month or so in dealing with the pandemic?
I think the driving force that makes the things is because this is a virus, and we know so little about the virus. So the information that we're getting isn't 100% complete. And then as we learn about the virus, and we've had to adjust our messaging, so you learn one thing one day, and then with almost no notice, it's, oh, no, that might not be right. Let's do this. So I think the biggest challenge has been that incomplete information, having to turn on a dime sometimes in dealing with the new information that we do get, and then adjusting how we're able to give the information out to the public so that they get good, accurate, timely information. And then if it changes tomorrow, well, obviously that causes some uncertainty and maybe a little bit of disbelief or what have you. So that's been really the most difficult, is dealing with the unknown about the virus itself.
All right, now let's switch over to a high note. What has been some of the what have been some of the best moments that you've run across on the pandemic? I think you probably touched on one earlier, but maybe there's another one that'll pop into your head as far as, I've seen the best of what's come out of this as well.
Getting to know all the people that have been working on this event has been amazing. I consider, even though I'm the DES coordinator and on the organ chart of the Unified Command, my name and John Felton's name at the top, but how incredibly lucky we are as a community to have so many talented people working on this project. From and I don't want to even name names because there's so many of them. I would sit here for 30 minutes naming names, but the Unified Health Command, the Economic Response Team, the first responders, it's just been amazing to work and learn from all of the different health organizations, economic organizations, first response organizations, the trust and the respect among the members that are managing this. They trust me, I trust them. We're able to bounce ideas back and forth and come up with what we believe is the best solution for Yellowstone County. But I would say that's by far the high point, is all of the wonderful people I've been able to work with.
All right. Well, Casey, thank you so much for joining us today. I know it's a very unusual circumstances, but it's a very unusual time, and it was great to visit with you and learn about what's going on in Yellowstone County and how Disaster and Emergency Services is part of that. So thank you for sticking with us. Thank you for doing the interview. We really appreciate it.
It was my pleasure anytime, and stay safe and wash your hands.